Good morning, all. Nice to be here on a DC humid day. So it's good to be inside with some nice air conditioning. I'm Bernie Rossoff, very fortunate to be the chair of the Institute of Medicine Roundtable on Health Literacy. And I'd certainly like to welcome everyone to today's workshop on health literacy and palliative care. I want to let everybody know that the meeting is being recorded and videotaped. This will be a really very special day for the Roundtable. Tackling an issue as important as palliative care is truly very, very challenging. And this challenge afforded us an opportunity to add a dimension to the many articles and teachings about palliative care, and that is health literacy and communication, the core components, truly the core components of a palliative care strategy. The Roundtable on Health Literacy focuses on building partnerships to move forward in the field of health literacy. As one of its major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and concern and relevance to the nation. We are extremely pleased to be able to convene this meeting to discuss palliative care and its relationship to health literacy, and the importance of health literate communication to palliative care, and also to the high quality delivery of care in general. As many of you know, palliative care provides a specialized team, holistic approach to providing medical care for people with very serious illnesses. The focus of palliative care is on providing relief from symptoms and improving the quality of life for patients. Palliative care is often simultaneously offered with curative therapies. It is our hope as we move forward that this workshop will help to further disseminate knowledge about the need for and the benefits of palliative care, and particularly how important it is to organize and deliver that care in a health literate manner. In general, low health literacy is a barrier to receiving high quality health care. In general, high quality health care nationwide. This is particularly salient for people living with serious or chronic illnesses that require complex management regimens and have significant symptoms or treatments with significant side effects. The ability to understand the scope of the illness, what is necessary to treat the illness, and how to live with serious illness as comfortably as possible is critical and crucial to patient treatment outcomes and the quality of life. We also hope the meeting will foster additional dialogue among existing organizations and individuals about the importance of and possibilities for health literate efforts on many levels, not only palliative care. I ask each Roundtable member, every Roundtable member, to be noting throughout the day key ideas or concepts that are brought out in the presentations and the discussion. And at the end of the day, I will go around and ask each Roundtable member to testify and briefly describe these key highlights. Now, this is a terrific workshop, and it takes a lot of effort to bring a workshop like this to its day. The workshop was organized by a planning committee, and we would like to extend our thanks to the members of that committee: Cindy Brack, Marion Grant, Renee McLeod-Sojan, Diane Meyer, Kim Parson, Yoel Schenker, and Paul Shivey. Our speakers today are separated into 4 panels, each panel moderated by a member of the planning committee. We will begin the day with a presentation from Diane Meyer. Diane will then introduce the first panel and moderate the discussion afterward. Please hold your questions until both presentations have been completed. I've also asked Roundtable staff member Melissa French. Melissa, raise your hand. There you be. To keep track of the time, so she'll be giving each speaker a 5-minute, a 2-minute, and a time-up warning. I'll now briefly introduce Diane Meyer. In actuality, Diane and I spoke very briefly before this meeting, and we recall many years ago when she was just beginning to discuss what is now described as palliative care, and was a guest speaker at our institution a number of times. And here we are today with a true program on palliative care. There are others in this audience that began with some of the work that we were not quite sure what we would note it to be called later on. Now we know it as palliative care, and we appreciate the efforts of people who began this at the very beginning. Dr. Meyer is the director of the Center to Advance Palliative Care, a national organization devoted to increasing the member and quality of palliative care programs in the United States. She is also vice chair for public policy and professor of geriatrics and palliative medicine at the Catherine Goldman Professor of Medical Ethics, and was the founder and director of the Hertzberg Palliative Care Institute from 1997 to 2011. Remember, 1997 was 18 years ago as we just began speaking about palliative care. All at the Icahn School of Medicine at Mount Sinai in New York City. For more information about Dr. Meyer, please see the biosketch that we've included in the book that you have in front of you. Thank you very much, Dr. Meyer.